Let's discuss the topic, headache. One of the most commonest nervous system disorder. Prevalence is about 48.9% population in general, mostly affecting the women. Only small population of headache disorders require specialist input. Vast majority can be effectively treated by a primary care physician. There are 17 types of headaches concluded. Primary tension headache that are episodic. Primary tension headaches that are chronic. Primary muscle contraction headaches. Primary migraine headache with aura, and headache without aura. Primary cluster headache. Primary paroxysmal hemicrania, which is a type of cluster headache, and primary cough headache. Coming to the 9th type, primary stabbing headache. Primary headache associated with sexual intercourse. Primary thunderclap headache. Hypnic headache. Hemicrania continua, which is usually unilateral, NDPH, headache from exertion. Trigeminal neuralgia. Secondary headaches, like trauma, disorders, and infection. Headache is usually a burden. 95% of general population have experienced headache at some stage in their life. It is recorded as 1 in 2 adults. WHO induces headache among top 10 causes of disability. The history which need to be: family history of headache, childhood migraine, any aura features, other autonomial features, current or prior treatment, and their lifestyle. The red flags that could indicate need for evaluation: new headache in older patients, change in mental status, new change in headache pattern, or progressive headache, any new headache in the setting of HIV, cancer, in immunocompromised status patient. Signs of systemic illness like fever, stiffness of neck, headache triggered by cough, exertion, Valsalva maneuver, headache during pregnancy. The first or worst headache need to be evaluated. Coming to the migraine. In this, headache may cause pulsating, throbbing, pain usually on one side of mind. WHO mentioned 6th highest cause of disability. In migraine, symptoms may include blurred vision, lightheadedness, nausea, sensory disturbances known as aura. The rebound headaches, caused due to the excessive use of medication to treat headache symptoms. These are most common cause of secondary headaches. They begin early in the day and persists throughout. Symptoms including neck pain, restlessness, feeling of nasal congestion, and reduced sleep quality. Cluster headaches usually lasts between 15 minutes to 3 hours. In between clusters there may be headache-free period. Pain in this type of headache are one-sided and severe, sharp and burning pain, and pain is seen typically over one eye. Thunderclap headaches. Patient describes as worst headache of their life. It may lead to life-threatening conditions, such as intracerebral hemorrhage, cerebral venous thrombosis, RVS, meningitis, pituitary apoplexy. What causes headache? Coming to the cause of migraine. In migraine, headache is caused by irritation and inflammations of structures around the brain. The systemic illness like dehydration or any infection is also called as toxic headache. Changes in circulation or blood flow or trauma can also cause headache. Other causes can be medication reactions, drug abuse, drug withdrawal. Every person is different from one another, so the history of headache is very important. Recognizing the patterns of food they eat and their personal stress factors in combination with physical examination. In the tension headache, the signs and symptoms include: to the patient, pain begins in the back of head and upper neck. There is band-like tightness and pressure. Most intense pressure is at the temples or over the eyebrows. Here, pain is not associated with aura. There is nausea, vomiting, and sensitivity to light and sound. The pain may vary in intensity, but usually not disabling. Doing his daily activities. Usually pain is bilateral. Here the pains are described in tension, sinus, cluster, and migraine. So guys, to manage headache, in our homes, take rest in quiet and dark rooms. You can compress your head with heat or cold as per comfort. Massage your head, never keep it too dry. Thank you for watching. Do subscribe to our channel. Breath Out Notes.